To build anything that truly lasts, it takes time.
At Apollo Hospitals, as in a major move, the company plans to list their digital and pharmacy business in the next 18 to 21 months. And in the new company, the company will have Apollo 24/7 as well as pharmacy chain Keimed. But what are the growth triggers going ahead? Let's try to decode that with Suneeta Reddy, Managing Director of Apollo Hospitals, joining us on the show right now. Hi Suneeta, morning and good to be speaking with you. Firstly, for the new company, you have come out with a very aggressive targets, talking about revenue of 25,000 crores by FY27, margins expected to expand and actually get doubled. Give us some sense that what's making you this bullish and which different segments are expected to contribute in which way?
I think basic is to look at Keimed grew 17%, so Keimed will grow by 19. The whole entity will grow by 20. And this is the deconstruct of the EBITDA that will happen in 2027. If you look at total revenues will move from the current 16,267 crores to 25,000 crores. EBITDA margin will be at 7%. Absolute EBITDA 1,750 crores. 1,000 crores of EBITDA coming from offline pharmacy. 700 crores of EBITDA coming from Keimed, and 50 crores of EBITDA coming from the digital.
Okay, and also help us understand Apollo Hospitals will continue to hold 15% stake in the new company. Why is that? If you could help us understand a little bit more on this.
So one is to maintain the synergies. We will work with the AHL, the new company. We will continue to work with them. So it makes sense for us to have a stake. And at any time that we would like, maybe post-listing, in case we want to monetize the stake, it will provide cash for Apollo Hospitals expansion.
All right, along with that, Suneeta, what we wanted to understand is that what synergy benefits could be at play that you are foreseeing between the two entities now, and will there be any non-compete agreement that will be at play? If yes, why so?
So the synergy benefit that we're first seeing is that, this is a digital healthcare entity, and it could be a very large funnel. In terms of customers, they already have 120 million customers. They do about 900,000 transactions a day. We are hopeful that this will increase the funnel to Apollo Hospitals in every location that we're present in. And this is one of the reasons why we believe that the synergies are important. Second, the digital will help us in terms of patient convenience, booking, diagnostics, making bookings with doctors, help us in condition management. So these are clearly the synergies that we see. Yes, you also asked about the non-compete. We're very clear about the non-compete. So Apollo Hospitals will not be setting up pharmacies, and Apollo HealthCo will not be in healthcare services, especially in hospitals.
Okay, but Ms. Reddy, with respect to pharmacy, help us understand your growth numbers in terms of the expansion, and along with that, how can we see the contribution of branded going up over the years?
So currently there's 6,626 pharmacies with mature pharmacies with margins of 10%. Private label in that and generic will slowly move up. Currently they're at about 17%, but we believe that with the combination of Keimed, that we can increase the absolute volume of both generic and private label. And this is one of the reasons why mature pharmacies have an EBITDA margin of 10%.
Suneeta, insurance is another area where the company is optimistic on the growth outlooks, and earlier you have been very bullish on the margins as well, as you highlighted that it's going to be a high margin business. What sort of a margins are you working with in terms of the expected growth, and at what point do you believe that will actually break even?
This year, the first year, it will not break even. The next year, they could look at 80 crores of revenue and a break even in the second year.
All right, Suneeta, apart from this listing, let's also talk about your traditional hospital business as well. You have been very aggressive with respect to the capex in terms of the target that you have already set. Help us understand that where are we right now in terms of the capex already mentioned? Is everything on track?
Yes, everything is on track.
Okay, so everything on track in terms of capex, but how do you plan to simplify the structure even more? What steps can you take? Also, along with that, will demerging or delisting the diagnostics or pharmacy arm as separate business, could those be one of the possibilities?
So I think this composite scheme that we have mentioned, which we've spoken about, clearly is about enabling the listing of that vertical, which includes AHL, currently HealthCo. It includes the demerger of Apollo Telemedicine. It includes the merger of Keimed into a new company, which after 21 months will get listed.
All right, Suneeta, all eyes on that. So good having you on the channel today. Thank you so much for taking the time out and speaking with us.